You're watching CTOM TV. Knowledge is power.
Okay, the question from Sharon. Someone I know was originally diagnosed with leukemia, and then it turned out to be mono. How does this kind of thing happen?
Well, it was probably a very poor diagnosis.
Okay. All right. Well, there's a lot of misdiagnosis in
Yes,
cancer. In fact, the
yes.
statistics are 1 in 5 cancer diagnosis is completely wrong.
We've seen that,
And
yeah.
80% of cancer diagnoses and treatment plans are changed significantly when genetic testing is added. So essentially, standard cancer diagnosis as it exists right now is almost certainly missing some key pieces or wrong. So that's something you can kind of tuck away, and let's always double check and get a second opinion with a cancer
We have the
diagnosis.
tools. They just need to be more out there and more accessible for everyone.
Yes, that's right. They are not part of standard care yet.
Exactly.
Yeah. So what would some of those tools be?
A PET CT.
Okay, that's.
I think inherited genetic testing should be done for everyone. Every person should have that. Regular checkups, regular blood work, different factors, like even having high cholesterol can increase your cancer risks. Just having a regular checkups is really, really important. And don't be afraid to go to the doctor with any complaints or pains or.
Okay, but how does that work with what you just said, which is, so here we've got somebody who was originally diagnosed with leukemia, which must have been very frightening.
Yes.
Only to find out they have mono, which is awful, but not quite as awful as leukemia.
Right.
So what you're saying is just go to the doctor more, but how do you know when you're going to a doctor who's using good tools or giving you an accurate diagnosis?
Well, once again, I would ask what their thoughts are on PET CT.
Okay,
right up front.
that seems to be the litmus test, apparently, from your perspective.
It is, yes.
Okay, because that indicates how up on
the diagnostics
science they are.
Yes, and the science in general.
Right. So if they're not in support or they don't think a PET CT would be helpful, then they're almost certainly missing some key pieces. Yes. Well, again, get a new doctor or hire someone to help educate your doctor.
Exactly.
Most doctors they're in the field because they want to help people. They're not trying to be ignorant of certain things. There's just no way they can keep up with all of the innovations in technology.
Well, the decisions in the medical system are not made by doctors. They're made usually by politicians.
Yeah,
and they're usually budget related.
Sure, of course. Especially in a public medical system, or in the U.S., where what is covered is determined by the insurance company, which is also kind of back to the bean counters, and more of the bureaucratic side of things to determine what they want to spend money on and how much money they have to spend. And that's the same with cancer care and public health care.
Yes,
for sure. Yes. So apparently with these types of things, if you want to find out if your doctor is up to speed with some of the most current bits and pieces that are available out there, Alex says, ask them about their thoughts on a PET CT. On the Cancer Treatment Options and Management website, it's ctoam.com. On our blog, it's under research in the top navigation bar, you'll find an excellent article on PET CTs, what they are, how they work. It contrasts PET CTs to CT scans and a few different more commonly used tests. There's wonderful references attached. That would be something for you to review for yourself to understand this concept more and know the value of that test. But also, if you are going to talk to your doctor and ask for one, print out and take that article with you or send them the link, because it covers all the bases, and people in the field of PET CT say it's one of the best articles I've ever read on the topic. So
it's very good.
Thank you for watching CTOM TV. Subscribe below and stay informed.